Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. Today we're going to go over cranial nerves and we're going to make it very simple for you guys to pass your next nursing exam. I'm going to show you 3 different ways you can learn them and you guys can choose which one you'd like to use to learn your cranial nerves. Now we're going to get right into it. I don't want to waste any time, but make sure you guys download the free cranial nerve worksheet that is available on our website. The link is down in the description below. First of all, what are cranial nerves? Cranial nerves are our essential communicators of our 5 senses and of course other functions that go on that are very vital to our survival. Now the reason why cranial nerves are so difficult is because there's 12 of them. And as you know, nursing school, you don't just need to memorize what they are, but you also need to know the function of each one. But we're going to make it very simple for you guys starting now. If you guys have that cranial nerve worksheet, make sure you guys fill it out as we go here. So of course, the first method that a lot of people like to use is probably the most popular one out there, but in my opinion, it's not the best one, but we're going to go ahead and go over it. It is the verbal mnemonic. There's lots of different ones out there, but the one I used to remember is on old Olympus towering tops, a Finn in German viewed some hops. Okay, so what does that even mean? Well, there's 12 cranial nerves, and really all that verbal mnemonics really telling you to do is remember the names of them. They don't really tell you the function. So I prefer ways to remember the name and the function, so that way I don't have to try to remember 2 different things at once. And that is why I prefer the kinesthetic method of learning cranial nerves. All right, so let's get started. So cranial nerve number 1 is your olfactory. It is what you smell. You have one nose, so you point at your nose. Cranial nerve number 2 is your optic cranial nerve, and you have 2 eyes. It is what you see. So you go cranial nerve number 1, olfactory. Cranial nerve number 2 is what you see. It's your optic nerve. All right, guys, so next, here's a little trick. Cranial nerves number 3, 4, and 6 all have to do with eye movement, okay? But the biggest one is you need to remember is cranial nerve number 3 is your oculomotor cranial nerve. And that also has to deal with pupil constriction. So you need to remember that. That's a common question. Cranial nerve number 3, oculomotor, is pupil constriction. So what I do with this kinesthetic method is, once again, cranial nerve number 1, olfactory. So you point at your nose. Cranial nerve number 2, optic. So you point at your eyes because you have 2 eyes. That's what you see. Cranial nerve number 3, 4, and 6 is eye movement. So it's your actual eye movement. So this is how I do the kinesthetic. I point at the nose. I go to the eyes, and then I go back and forth eye movement because it's 3, 4, and 6. But since cranial nerves number 3, 4, and 6 all have to do with eye movement, I can still remember the specific function of each one of those by doing the kinesthetic method. So I go number 1, olfactory. Number 2, eyes, optic, it's what I see. Numbers 3, 4, and 6 is eye movement. So here's the trick. Ocular motor is your pupils, right? So you hold it in front. So pupils. Cranial nerve number 4 is your trochlear nerve, and that controls your inward and downward movement of your eye. You start in the middle because that's your inward, and then you go downward because that's your trochlear, because that's next. So you did 3 because that's pupil constriction, and then you go inward, downward, trochlear is your cranial nerve number 4. And once you're down here, you go back and forth because cranial nerve number 6 is your abducens, because then you start going back and forth because that controls your lateral eye movement. So we skip cranial nerve number 5. What is cranial nerve number 5? It is your trigeminal nerve, and it controls your facial sensation. Okay, so it's what you feel on your face, and it has to do with your chewing as well. All right, let's do the kinesthetic method again. So number 1 is your olfactory. It's what you smell. Number 2, it's your optic. It's what you see. Number 3 is your ocular motor. It's your pupil constriction and eye movement. And then number 4, your trochlear. It is your inward and downward eye movement. And then cranial nerve number 6 is your lateral eye movement called the abducens. So it goes back and forth. And cranial nerve number 5 is your facial sensation and chewing. It is your trigeminal. And just like that, guys, we're halfway through. We did cranial nerve 1 through 6. And it's actually pretty simple because you can group 3, 4, and 6 once again together as eye movement. Just remember, ocular motor is the one that controls the pupil constriction, because that is a question quite commonly seen on your nursing exams and the NCLEX. All right, what's next? Cranial nerve number 7. This is your facial nerve. Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. So this controls your facial movement. So think of a smiley face, and also think of this as your taste as well. So cranial nerve number 7 is your facial nerve that controls your facial movements. So pretty simple if you think of it. The name really tells what the function is. Cranial nerve number 8, your vestibulocochlear. So this is your hearing. So this one's pretty simple. It's just what you hear. All right, guys, we have another group. So cranial nerve number 9 and 10 have to do with your swallowing. Cranial nerve number 9 is your glossopharyngeal, which means tongue and pharynx. So that has to deal with the swallowing function of your tongue and your pharynx. So it's your posterior. So it's going to deal with your gag reflex. And then cranial nerve number 10 is your vagus nerve, and that has to deal with the swallowing function of your pharynx, larynx, and soft palate. Little side note, the vagus nerve also has to deal with some autonomic functions such as the heart rate, digestion, and the respiratory. Now, next, guys, is cranial nerve number 11. It is called your accessory nerve. It actually helps with shoulder shrugging and head movement. So this is what I do with the kinesthetic. So shoulder shrug, head movement. And then lastly, cranial nerve number 12 has to deal with your tongue movement. It is called hypoglossal. So cranial nerve number 12, when they ask a question about your patient's tongue movement and their ability to speak, that is your hypoglossal cranial nerve. So cranial nerve number 12. All right, guys, let's do the full thing together. If you guys follow along, this will also help you understand the names and the functions of each one. So cranial nerve number 1, olfactory, it's what you smell. Cranial nerve number 2, optic, it's what you see. Cranial nerve number 3 is your oculomotor, it's your eye movement and your pupil constriction. Cranial nerve number 4 is your trochlear, so it's your inward and downward movement. And then cranial nerve number 6 is your abducens, so it's lateral eye movement. Cranial nerve number 5 is your trigeminal, your facial sensations. Then cranial nerve number 7 is your facial nerve, which is your actual facial movement, so you smile. Cranial nerve number 8 is your vestibulocochlear, so what you hear. Cranial nerve number 9 and 10, number 9 being glossopharyngeal, number 10 being vagus, both have to do with swallowing. Cranial nerve number 11 is your shoulder shrugging and head movement. It's your accessory cranial nerve. And then cranial nerve number 12 is your hypoglossal, so it's your tongue movement. All right, guys, we aren't stopping there. Let's go to the next method of how you can learn the cranial nerves. We're going to draw a picture of a face. Now, the drawing method is a very good one if you're a visual learner because it helps you visualize what the function is as well. All right, so cranial nerve number 1, we talked about that being olfactory. So the olfactory cranial nerve has to deal with your sensation of smelling. So we're going to put a nose here with the number 1. And then cranial nerve number 2. Once again, that is your optic cranial nerve. That has to do with what you see. So we're going to put those as eyes on our face here. And then we talked about 3, 4, and 6, all dealing with eye movement. What's surround the eye with 3, 4, and 6? So we're going to put 3 as the eyebrows. Now remember, cranial nerve number 3 is your oculomotor. It has to do with eye movement, but it also has to do with pupil constriction. And then cranial nerve number 4 is your trochlear cranial nerve. So it's your inward and downward movement. So we're putting that on the inside of the eye. And then cranial nerve number 6 is your abducens. So we're going to put that on the lateral side of the eye because it has to do with lateral eye movement. Now, cranial nerve number 5. Let's draw on the face because trigeminal has to do with facial sensation. So we're going to draw a 5 on the face. And then cranial nerve number 7 is your facial cranial nerve. And that, of course, has to deal with your facial movement. So we're going to draw the outline of the face. And then cranial nerve number 8, your vestibulocochlear. So we're going to draw some ears with some 8s here. And then cranial nerve number 9 and 10. So number 9 being your hypoglossal. So we're going to draw a tongue with a 9. And then we're going to draw cranial nerve number 10 on the back of the tongue, meaning that's your vagus nerve because it controls your swallowing of your pharynx, larynx, and soft palate. And what is on the soft palate? It is your uvula. So that is why we draw the 10 here. And then cranial nerve number 11, it is your accessory cranial nerve. So it has to deal with head rotation and shoulder shrugging. So we draw it on the shoulders here. And then cranial nerve number 12 is your hypoglossal. So it is your tongue movement. So we're going to draw the 12 inside the end of the tongue here. Now, the last thing you'll probably want to know for your cranial nerves is identifying if it's a motor, sensory, or mixed cranial nerve. Now, sensory cranial nerve meaning that it only has a sensory function. So think of your 5 senses here. So your sensory cranial nerves would be olfactory because it only has to deal with the sensation of smell. Cranial nerve number 2, optic, because it only has to deal with what you see. So that's another sense. And then cranial nerve number 8, it only has to deal with what you hear, so vestibular cochlear. Those are your sensory cranial nerves. Now your motor cranial nerves have to do with movement, so they only help with movement functions. So that would be your cranial nerve number 3, your ocular motor, moving your eyes. Cranial nerve number 4, your trochlear, moving your eyes as well. Cranial nerve number 6, abducens, also moving your eyes. And then cranial nerve number 11, accessory, moving your shoulders and head rotation. And then cranial nerve number 12, your hypoglossal, moving your tongue. And then your mixed cranial nerves both have a sensory and motor function. So those would be cranial nerve number 5, your trigeminal, because it has to do with facial sensation and chewing. So movement from the chewing, sensation of touch from the facial sensations. And then cranial nerve number 7, your facial. So it's also your facial movement. And then also your sensation of taste. So that would be your sensory function. And then cranial nerve number 9, your glossopharyngeal. So once again, your movement, such as the swallowing function, but it also has to deal with tongue sensation as well. So the actual touch sensation of your tongue. And then cranial nerve number 10, the vagus, once again, the motor function would be the swallowing, and the sensory function would be the autonomic functions such as controlling your heart rate, digestion, and respirations. And then the vagus nerve also has to deal with tasting of the posterior tongue. So those would be your mixed cranial nerves. All right, guys, so if you haven't already, make sure you guys download that free cranial nerve worksheet to best understand the concepts that we went over today. I'm looking forward to hearing how you guys did on your nursing exam, and I'll see you guys in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.